Welcome to Mental Stillness. My name is Derek, and I'm excited that somehow you stumbled across this podcast. One of my goals when starting this podcast was to bring mental health conversations into leadership circles. I have another awesome guest in Dr. Cameron Roth. And a little bit about Dr. Roth is he is a fellowship-trained orthopedic surgeon specializing in hand, wrist, and upper extremity surgery. The biggest reason I wanted to have him on as a guest is that he has a patient-centered approach. And what that means is that he truly looks at his role in helping people. He sees it through the lens of empathy. And we talk about a couple scenarios of what that might look like when he walks into the consultation room with a patient. And it's really encouraging hearing a surgeon have that kind of approach for people and care. And the fact that he leads with empathy, I think it will translate to all of us, regardless of what field we might be in. On top of being an empathic orthopedic surgeon, some other interesting facts about him is that he is a consultant for Major League Baseball's Chicago White Sox. He grew up playing sports. He played in college. Him still being connected in sports at the highest level and getting to do that as part of his profession just sounds like a really cool opportunity. A little behind the scenes with the recording of this episode is that Dr. Roth lives in Arizona and I live in Kentucky. And so trying to find a time that worked for both of our schedules meant that we recorded this at 10 p.m. Eastern time. And so if I look tired, if you're watching on YouTube or Spotify, or if I sound tired, if you're listening on Apple, Amazon, or anywhere else, it's because I was. But enough on that. Enjoy the conversation with Dr. Cameron Roth.
My name is Cameron Roth. I'm a hand and upper extremity orthopedic surgeon based in Phoenix. I grew up in the Boston area. My father was a surgeon. And really his influence, obviously with the influence of my mother as well, propelled me into medicine from a young age. A relatively typical story, I think, for an orthopedic surgeon. I was a high school and college athlete. I was involved early with some doctors in the community, and I also had the opportunity to start at the bottom level. So my summer job for 5 years was cleaning the operating room at my dad's hospital and transporting patients around the hospital. And once you step into the healthcare arena, opening your eyes and meeting nurses and doctors and assistants and people who really take care of patients day in and day out, and you really see the team aspect and what it takes to really propel good care forward, that hooked me, I think, immediately. And then just moved forward, a couple obstacles in the way, but through college, I lived in Central America. I taught English for a while, but eventually ended up in med school residency, and I just finished my subspecialty training in fellowship last year in Boston. So I've been in practice for about a year. It's been an incredible experience. I've met a lot of very interesting people, taken care of a lot of really great and motivated patients. I've learned a lot from my mentors along the line, and hopefully I have some I don't want to say advice, but I think experiences that I have found valuable for me and lessons that I've learned from other people more experienced and much wiser than myself that hopefully I can share with you today. And I know you're going to ask great questions based on some of the episodes that I've listened to in the past. So I really look forward to speaking with you and hopefully learn a lot from you and share some experiences with everybody.
First surgeon we've had on the show. For me, it's less about being a surgeon and more about your philosophy behind it that really drew me to you. And I think my audience of the way in which you go about doing the work that you do, really that empathic approach is so important. I would argue in any industry, but especially in something as vulnerable as you're getting ready to go under the knife and put your life in the hands of somebody else, having someone that's empathic and caring, like that would be necessary for me to want to do that with somebody else. And so just out of curiosity, how did you find yourself into the specific subspecialty you found yourself in?
So my dad was a neurosurgeon, so he's a brain surgeon and a spine surgeon, and And I ended up taking the other road, which is orthopedics, where most sort of ex-athletes end up. And I found myself in orthopedics for a multitude of reasons. I love the patient care, so you can really get people back to their active lifestyle almost immediately. You can almost fix people, and I'd like to put "fix" in quotes because it's maybe a little bit more complex than that. But if someone breaks their wrist, you can do surgery on them and repair their wrists and get them back to playing pickleball and playing golf and tennis and being with their family pretty quickly. And I think that's a nice satisfaction that we have. I like the personality of the people we work with. I like the tools that we work with. I mean, we're essentially human mechanics. But it's a fun, mostly upbeat group of patients, very motivated. People want to be healthy. People want to get back to what they're trying to do. And that's what drew me to it as an ex-athlete, as the son of a surgeon. When your patients are happy, you are happy. And that's the best part of the whole job.
For the non-surgeons here, we may not be surgeons, but everybody feels stress, no matter what you're doing. And so when it comes to managing stress and emotions, in particular high-stakes situations, what have you found that's worked well for you? And maybe, I know you mentioned athletics, maybe it has to do with more on the performance or more on the field or whatever, but also like in your profession, like how do you manage stress and emotions in those high-stakes environments?
No, that's a great question. And obviously we undergo a lot of stress, but I think you said it correctly. Everyone undergoes stress, whether it's family stressors, professional stressors, relationship stressors. Living is hard, and our jobs only make it harder, especially when you're taking care of others or in a business serving others. It's very, very stressful. So it's just hard to navigate life as it is. So I think I always tell people, and I didn't make this up, I took this from one of my mentors, but if you can't take care of yourself, you can't take care of other people. So if I see my outward facing physician profile or professional or personal profile faltering or wavering, I know that I have to look inside and take care of myself first. So in high stress, acute situations in the middle of things, that just brings me back to connecting immediately with my breath and then taking a step back and then saying, okay, how do I take the next 5 seconds, 10 seconds, 15 seconds to rectify the situation and think? And if it's a problem that needs to be solved, do I think back on my experiences, which are usually pretty helpful. Overall, if I'm just trying to manage myself overall, I look at it coping mechanisms, so humor, diet, exercise, family, friends, any interests outside of medicine or my professional world, connecting with people who have given me advice in the past that have had similar experiences and can provide good advice. It's really just a circle of talking to friends, family, and mentors. I've had experiences, they've had more experiences. People who are listening will have similar experiences to you and me. And it's all, we're all living in the same place. But it works for me most of the time. I sleep relatively well most of the time.
Yeah. Well, a couple interesting things that jump out to me from what you just said. One, it's having the network of support is necessary for whoever you are, whatever you're going through, whatever industry you're in. Having people who are a little further down the road than you, and also just people who care about you in general. Having the network, but then utilizing the network, and like you said, knowing those moments when I need to kind of go and seek out that proactively. How would you fold in leadership conversations and explain leadership and explain maybe leadership that's worked well or not worked well that you've observed and in all your years of experience in the healthcare setting? Help us understand that. We have a lot of people in the leadership spaces, a lot of different industries, and so give us a little bit of sense of healthcare and leadership.
Being a medical professional is just like playing a team sport. So there's an immense amount or a large amount of people who go into just the care of one patient. So if you have a patient in the hospital, you have the physician, you may have residents or fellows, you have nurses, you have other staff on the floor. You have people in the lab, people who take x-rays and CT scans. You have people who clean the room. You have people who deliver the food. And that's all just for the care of one patient. So if you have an 800-bed hospital, you have 800 patients in the hospital. If you have 40 patients in your outpatient clinic, you're seeing 40 patients a day and using all the resources that you can do to take care of these people. And it's not just one person. So as the physician, there is somewhat of a hierarchy, so you are really at the spear point of that team. So I think it's important to involve all of the people working together and not treat it as, authoritative or dictatorial, but more democratic. Because everyone has different experiences. Everyone has seen in their training different ways of taking care of people, different types of empathy and compassion, different techniques that work. And it's important to learn from those people around you. So it's a complete team-based approach. It's not the doctor says this, so we're going to do this. It's, look, I may have the most medical experience and medical expertise, but here's what I'm thinking. Does anyone have any suggestions? Does anyone think that's a good idea? Does anyone have any thoughts or concerns? And involving people in really a Socratic sort of discussion versus a, one person leading and everyone following blindly. That seems to have worked for me in my relatively limited experience at the head. And I've taken that from my mentors whose influence I cherish. And I think the reason I don't do it the other way is because I've seen it done the other way. And it just makes for an unhappy team. An unhappy team leads to bad care and bad patient outcomes.
Yeah, some of those biggest leadership lessons we all get is being on the other side of a leadership style we did not resonate with and did not appreciate. And you talk a lot about mentors, and so do you find a lot of your mentors being other physicians and surgeons primarily, or you kind of pull from different backgrounds?
So honestly, I would say the majority of my professional mentors are really orthopedic surgeons, all the way back to when I was in high school in Massachusetts. There's two that I can think of, but when I was a trainee in Chicago or Boston, I have a lot of people that I speak to arguably almost on a daily basis, whether it's through text, email, phone call, just to ask their advice. Usually it's about patient care, but every once in a while it's about professional development or personal development. And I wouldn't be here today if it weren't for them. I honestly wouldn't be here today if it weren't for my parents, and I'm sure that's the same for the majority of people who, sort of push you and
that's true on a lot of levels.
Yeah, exactly. So. Of course, it's true at the most basic biologic level, of course. But I'm just lucky to have a group of people who support me, because in my future life, I want to give all of that back. I want to be on the mentor tree or the mentee tree of some, docs moving forward. Because what I've learned and what I will continue to learn, I want to keep giving back.
Yeah, I know you talked briefly about your work in Central America, and so I guess touch on how did that come to be? Like, what kind of work?
Yeah, so it actually wasn't primarily medical work. So after I graduated from college, there was an organization that started at Vanderbilt University, where I was an undergraduate, which had programs.
Can we just shout out Vanderbilt real quick?
Yeah, that's right.
I'm sorry. Is that
Go
okay?
Doors.
Okay.
Go Doors. That's right.
Yeah, there we go. Sorry, go ahead.
Kings of college football.
Man, I saw them throw the field goal post in the river there. So
in the Cumberland, yeah. That's right. I wish I were there. 15 years ago, I would have been there.
Likewise. Sorry, go ahead.
No problem. So they had 3 program sites in 3 Central and South American countries. And I had the opportunity to spend a year teaching English and doing public health work in Guatemala. So I was essentially a volunteer for an NGO, and this is sort of a secular, non-religious, just service organization. And I spent a year teaching 7th and 8th grade English. And we also did public health projects, so basic public health hygiene, so hand washing, appropriate food care. I started a small business where you made soap, from household items for the women in the community. And that was my, not introduction, but continuation of service that I started when I was in high school. My parents sent me on one of these international trips to Costa Rica, where you spend a month, sleeping on the floor and doing manual labor, and it was completely eye-opening and life-changing, and it accelerated my Spanish language development and my connection with the Hispanic community, and my love and respect for the Latin culture and Latin countries, and then I lived in Guatemala, and I think that was it. So I said, this is for me. So, for example, we're actually going on a service trip this weekend to Mexico to do some surgeries this weekend for underserved communities, and that's just been part of my life, and to sort of live in the service of others, I think, is incredibly gratifying. It's not completely altruistic, because I get an immense amount of satisfaction from it. But if you have the ability, even if you're just providing advice online or helping people hand to hand, I think you should be able to do it. And those early experiences really propelled me to that point.
Assuming that was something modeled and you experienced kind of in your upbringing, that was a normal part of how you operated?
Yeah, it was. I mean, my father was a physician and my mom is a physical therapist, so both in the healthcare field, both serving others. My father's patients were incredibly gracious, and in a debt of gratitude towards him. So you would see, the way he was treated by others with immense respect, and he would get spotted in Logan Airport in Boston and say, "Hey, Dr. Roth, you took care of me, 20 years ago, and it changed my life." And that really makes a mark on you. And you think, wow, I can't believe my dad has the ability to do this for people and change their life and make it so much better. I wish I had that ability. And then my parents exposed me to, as many different experiences as you could, I guess, growing up in suburban Boston. But, we travel around the world. I was, again, sent on this trip to Costa Rica, and they encouraged me to continue my Spanish language development, encouraged me to live in Guatemala, and encouraged me to continue traveling, and hopefully these are opportunities that I can give back.
Side question from just
Please.
Curiosity. So when you're watching, you're a big sports guy, so I'm guessing you enjoy watching sports as well
Sure.
as playing sports. When it comes to, we'll say NFL, someone gets injured on the field, they're down, everybody's going out there and checking. Like, do you, as a surgeon, orthopedic surgeon specifically, like, do you kind of find yourself trying to guess what's going on based on what you're seeing?
I think that just happens by habit, honestly, because no, the replay is so good now. They have such good slow motion replay, and they show it so many times that you have a pretty good idea of what's going on, especially when you see what we call the mechanism, or the way that they were injured. And the most common ways that these injuries happen. So ACL, a non-contact knee injury, or a shoulder separation when a quarterback is sacked and lands on his shoulder. You have a general idea of what's going on, and then you probably know the time frame for return as well.
Mm-hmm. Unless you're Aaron Rodgers, and it's like he was out for like 2 months, it seems like.
So I actually always talk about Aaron Rodgers in my clinic, because in the past, when he was on the Packers, he broke his collarbone, and most collarbone fractures, at least in my practice, you can treat without surgery, and they just sort of heal over time, and the bones.
I've broken both of mine, by the way. So
did you have surgery?
Neither time.
See?
So the first time riding a bike, first time and last time snowboarding. So
it's very common, riding a bike and snowboarding. But Aaron Rodgers, they fixed his clavicle because he makes $30 million a year, and I think he went back to playing. And I may be wrong, so someone can fact check me, but I think 6 weeks after his surgery. And that's the 6-week mark is sort of where the bones heal. But that's an incredibly high risk to put yourself. If you get hit in the wrong way and your clavicle breaks again because it's not fully healed and that plate pulls out or something, there's a lot of scary stuff in there. So I tell, and it's mostly my pediatric and sort of young dirt bikers and young snowboarders who we treat without, who I treat without surgery, who want to go back to their activities as soon as possible. I say, look, if you were Aaron Rodgers and you get paid millions of dollars to play football, or you're Shaun White, you get paid millions of dollars to snowboard, I would technically have to let you go because you would assume the risks and benefits. But every week that you go without doing your contact sport or your aggressive activity gives the bone another chance to heal and put yourself at less risk. So you really have to weigh the risks and benefits. And that's usually with the kids a family discussion. And then, the majority of these high school kids don't go back for 8 or 10 weeks to full contact football. But, if they really want to, they could go back at 6 weeks if they understand the risks and benefits. But you said Aaron Rodgers, so that's sort of, I always tell the Aaron Rodgers story in my clinic.
I feel like the timeline on some of those things, and probably I'm a little sensitive to it again because I felt like I was down way longer than he was, and
well, that's right. You don't get
a little bit different access to care too. So
also true.
One of the things that's super important in leadership spaces is this idea of emotional intelligence. That's an area of interest for you and something you lean into. And so the role of emotional intelligence in healthcare leadership. I guess what does emotional intelligence mean to you from your side of things? And as you hear that through your lens and your context, how have you seen that benefit and play out?
That's a good question because, I have a lot of friends who have graduated from business school and they spend 2 years reading books from various professors about, emotional intelligence and the 4-hour work week and all this kind of stuff. And obviously everyone has different skills. I guess emotional intelligence is more of sort of the bedside manner of life. Like how do you interact with people on a daily basis in all situations, right? So how do you interact with your spouse differently from your children, differently from the barista at Starbucks, differently from your doctor, your doctor's visit. In the healthcare field, it's all about managing personalities. So everyone comes to see you for a reason. Everyone comes to your clinic for a reason. They have, for me, shoulder pain, I broke my wrist, and everyone has different personalities. You've never met these people. You don't know anything about them. But you have a common thread. You have a common goal. And that's to figure out what's going on and offer your best professional recommendations to give them the best possible care. And that can be very challenging, managing expectations. Hey, I want to, we have a big gymnastics tournament in 2 weeks. Or, hey, we're going to Mexico in a month. Do you think we'll be able to do it? Or the other doctor said that this didn't need surgery. Or the other doctor said I needed emergency surgery. And that's where you have to put your emotional intelligence hat on and say, okay, this is an individual person. This is the biggest part of their day, arguably, the doctor's visit. I broke my wrist. What's going to happen? How can I focus on that person and manage that person to the best of my ability? So that's offering empathy, compassion, involving family members, asking questions, answering their questions, being transparent, not being rushed. Those are all things we aim to be. Nobody's perfect, but I try my best. How can we both accomplish the same goal, even if we have wildly different backgrounds and wildly different personalities? Because we both want the same thing. So how can we work together? How can we just meet in this acute setting and work together towards success? How do I get you to trust me immediately? Because people will trust you immediately. And I would hope they do, but it is a privilege being a physician that people, as soon as they meet you, they trust you. I mean, they will trust you so much that they will allow you to put them to sleep and cut them open with, serious complications and some scary things can happen. And that's an incredible amount of trust, and that's an incredible privilege that we have, and I try never to take that for granted. But you have to earn that trust. even if your credentials and your biography may give that trust on an outward-facing experience, you still have to earn that trust. And not only with the patient, you have to earn that trust with the parent or the brother or the husband. And that's all under the emotional intelligence bucket.
How do you meet somebody? Let's say a little case conceptualization here. Someone comes in and they're maybe trusting, but they're also extremely fearful. Maybe it's a minor, maybe it's someone who's had a bad experience, whatever. I guess, what is your approach? You walk in there and you can sense that fear. How do you meet them where they're at in that context?
That's a great question. So what I try to do for every patient is I introduce myself. I introduce myself by my first name. I shake everyone's hand. In my clinic, so a lot of people have injured hands or arms, so they'll always have one arm sort of slung up against their chest, and they'll give you their other hand sort of like that. And I sit down next to them, and you can tell, you can tell by people's facial features and sort of how they're dressed and their mannerisms, what their general attitude is and how they're feeling. And you sort of offer yourself up. So you say, "How can I help you today? What can I help you with today?" And they'll say, "Hey, I broke my wrist. They said I need surgery." And I said, "Okay, well, let's talk about that. And then let me learn a little bit more about you. So, tell me a little bit about the injury. What do you like to do for fun? Are you working? Are you retired? What are some of your favorite activities? You know what we should do? Have you seen your x-ray? Have you seen your imaging? Let's look at it together." Even if they say yes, okay, let's look at it together and get a general understanding of what's going on. So I think the more information and the more transparent you are for the patients, the better they feel. They say, okay, this doctor, he's taking the time to get to know me personally, because you can treat an x-ray or you can treat a patient. I'd prefer to treat the patient. So he's getting to know me personally. He's providing me information and showing me what my wrist looks like under x-ray. He's providing me options, no surgery, surgery. Here are the risks and benefits of no surgery. Here are the risks and benefits of surgery. Here's what I would personally recommend. Here's what I've seen in the past, what has worked, what has not worked. And then what do you think? So what questions can I answer for you? What questions can I answer for your spouse or your family member? What concerns do you have? Do you have anything important coming up? Do you have a big sporting event? Do you have a big 50th wedding anniversary trip to Europe coming up? Those are all important nuggets of information that I think make people feel more comfortable and also help me make a very informed clinical decision.
When I was in a clinical setting, and it was a free clinic, and we had medical, dental, mental health services, and I oversaw the mental health side of things. And a lot of our providers came in, and it was volunteer based, and said, come in and they give X number of hours a month and see an underserved population. And one of the enticing things about coming to the clinic, and we had a really high retention of these volunteer providers, and they're amazing people and did amazing things, was, hey, like, strip away all the things that drive you nuts about the profession, that get you away from like helping people, all those other barriers and different things. Like, if you could really spend time with people and there wasn't a quota you had to hit per hour and all these, all the pressure and the pace of things that is very common in other settings, like, come and do it here. And they love that, because that was really hard to accomplish in the normal kind of healthcare setting. And so being someone that has the bent that you have, empathic care and trying to meet the people, but then also that pressure side of the amount of people you're supposed to see and get through. And how do you navigate that as an empathic orthopedic surgeon?
That's a really great question. That's something I have to mull over all the time, because you do have a large amount of people to take care of, and there is always that push-pull of how long can you spend talking to people, because people want their questions answered. People want to feel that they had their appropriate amount of time with their provider. So yes, I run behind in clinic. That's for a variety of reasons, but one of them is probably I tend to answer as many questions as I possibly can, and then spend the rest of the day apologizing to everybody because I'm late. But I think people appreciate that I've spent an extra couple minutes with them trying to answer their questions. And hopefully they feel informed or more informed when they leave. You can never get it perfect, but you can just keep trying and trying and trying.
I would imagine once people, I guess, have an appointment and get to experience a provider, and if it feels genuine and they feel like they got to receive that, it probably allows them to have more grace.
Yeah, that's for sure. When you get to know people and you develop a rapport, it's fun to see those people. Even if they're having a downturn in their recovery, you know them, and that's when your emotional intelligence really kicks in, because then you can really identify them on a deeper level, and you get to know these people more and more, and you can provide them support and empathy if they're not doing as well, or you can provide them encouragement. You can provide them more detailed answers to their questions. I like providing a lot of patients with my email address so they have direct access to me. So if you really develop these relationships with patients, then yes, they do provide you more grace moving forward, which is greatly appreciated.
One of the, I guess, opportunities that you've been able to do is doing some consultation work for the Chicago White Sox. And so how did that come to be, and what does that entail?
So I was very lucky. The group that I'm part of, we take care of a wide variety of professional sports teams in Arizona, and as most people know, half of the Major League Baseball teams do spring training here in Arizona. So a lot of the physicians in my group take care of various teams: the Chicago White Sox, Los Angeles Dodgers, Arizona Diamondbacks, etc. So as an upper extremity surgeon, I'm interested in what we call the throwing athletes, so shoulder, elbow, baseball, a lot of pitching and throwing. It's a big part of the game. And I was just lucky enough to get hooked up with one of my senior mentors here in the group, and there's an opportunity to help take care of the White Sox during spring training mostly, but year-round, because they have a team down here year-round, and then they send the major leaguers and minor leaguers back here for rehab year-round. So February and March, we do a lot of work there. So we do the physicals, we cover the games, we see the patients in clinic, major and minor leaguers. And then throughout the year, periodically, we'll have to go to the facility and do a physical on a new player, or see a player in clinic, or someone got hurt in a recent game, or they sent someone back from Chicago for rehab. And we just recently, a few weeks ago, did our exit physicals for the minor league players. The major league physicals are done in Chicago, and then the season will start up again or spring training starts again in February, and I think we'll be back at it again. They didn't have the greatest season, but we can just do our best to provide the best possible care.
Is there a little bit of like, when you talked about some of the different physicians have different teams they work with, I mean, does that provide a little bit of like competitiveness between you all far as the?
I don't, maybe for the more senior physicians, but not for me. I just think it's a great opportunity to really learn from the experienced team doctors, learn from high-level athletes, because it's a large volume of the same or similar injuries in very high-level athletes, and you get to see how the most elite athletes are rehabbed and what kind of surgeries and what kind of treatment that they get, and you get to see the best trainers in the business, the best medical directors in the business, the best surgeons in the business, and it's a cool experience. It's a great learning experience for me, and it just makes me more confident in my ability to diagnose, and more confident in my ability to take care of all types of patients, because we take care of all athletes, pediatric and high school athletes, college athletes, and of course the top of the top. But it's a great learning experience for me. It's a lot of fun. I've met a lot of really incredible people through it, and I look forward to being there when they turn this thing around and make the playoffs and go on a run one day.
Curious, were you a Chicago sports fan when you were?
I did my residency in Chicago, and I lived on the north side. And one of my close friends used to play for the Cubs, and now works in the front office for the Cubs. So I guess I technically was more of a Cubs fan, although I was a resident at the University of Chicago, which is about 2 miles from the White Sox Stadium on the south side. So I went to more Cubs games than White Sox games, but I'm just a fan of good baseball.
I don't think I asked you. I know you said you played competitively kind of growing up. What were the sports you played?
I was a high school football player, and then I played college lacrosse.
Oh, very cool.
Yeah.
Is there anything about the journey of going through the training and becoming a doctor and anything that was unexpected? I mean, I know you said you had someone in the family that had a similar path, but I know is there anything that's like, Dad, you didn't tell me about that? It's like one
Yeah,
thing to hear about it, but to experience it, there's
yeah.
got to be some things that were revelations, I guess.
I think two things. Um, Number one is the amount of time and effort and people it takes to take care of one patient. So I think I mentioned this earlier, but um, just the the sheer amount of work it takes to navigate a patient through their hospital visit. And this is just an inpatient visit. This is just people staying in the hospital for a variety of things, pneumonia, a broken leg, etc. Just the immense amount of work and team that it takes just to take care of one patient was mind-blowing. And then two, I think the second was I didn't realize how social the medical field was. I mean, it's the hospital and the clinic are your second home, and the people who work there become your friends and family. And then you're meeting new people every day, and you're meeting people all shapes and sizes from different backgrounds, and it's kind of like speed dating every day in the clinic. Um, and it's very enjoyable. I think if you are open to meeting new people and open to having conversation and banter and being a detective and trying to think and trying to help people, it's very social and it's very, very stimulating. I thought surgery was going to be very, I guess, stoic and very sort of intricate, and sometimes it is, but I thought surgery was going to be by far the most difficult part of being a physician. And yes, surgery is incredibly difficult, and it's very, very humbling. But I think just patient care and working with patients, and I talk about managing expectations all the time, I think that's the most difficult part, and I think that was the most surprising thing to me.
It seems like a lot of corporate types are feeling like, hey, I've got a lot of leaders who in the past were coming to work, were coming to be part of the organization, part of something, and it was a bit more transactional. Like, like they had some social things outside of work that those boxes were getting checked. They're better compartmentalizing, and now it's like, now, oh wow, now I'm having to lead in a way where they're wanting me to check a lot more boxes. Like they're wanting me to lead them in a more transformative way and expecting me to meet some of these needs. And so I find myself coaching a lot of people and talking to these leaders of equipping them more to, they can't be all things to these people, but how do you meet them where they're at, and at least maybe there are some things that you can grow in. You've been doing things for 20 years a certain way, and you know what, maybe this is a little bit of a redefining your leadership style to maximize results, but through these people feeling like they're having more of those needs met at work than maybe they used to.
We spend so much time in our professional setting that you get to know people relatively intimately. And if you find a leader or a boss or a colleague who you want to emulate, you hope that you can take home important information, advice, tactics, characteristics from these people. You would hope that, since, let's say, people who work 40 hours a week, the 40 hours a week is a lot of time to spend with random people from, wherever who happen to have the same job as you. You hope that you're not just transactionally working with people, but learning about people and gaining their good traits and also learning what not to do. And now that we're all hyper-connected globally, and there's so many, large business leaders, if you think of some tech leaders, recent inspirations who, people write books about and their quotes and everything. And I think everyone, or hopefully everyone, wants to be like the good ones. And obviously there have been some bad ones, but if you're just the leader of a small business, you can still have that effect on the people you work with. You don't have to be Steve Jobs. You don't have to be a visionary, but you can send people home every night with good feelings and good thoughts, and saying, "Hey, I really like I'd really like to emulate, what my boss. I really like the way my boss treated that customer today, or how, or he or she, made that deal, or had that discussion, or won that, argument."
I think the leadership of, like, it's about what's not said, has as much influence as what's said. And if I have someone I'm leading in my team, if I can model for them even something like, let's say you're in a setting where you're trying to navigate work-life balance. I know that's a divisive. I don't know. There's a lot of different opinions on work-life balance, but it is, if you're trying to be as present and as impactful at home as you are at work, it might be the most impactful thing you did that day as a leader is what you left at work. I'll leave that for tomorrow because it's more important for me to get to the softball game for my kid. And it's that kind of impact and influence, and especially in high level leadership, to where I think some people come into organizations just like, I got to do a 60-hour work week, and just I'll see my kids in 5 years once I kind of get once I make a name for myself and do that. But like, I do think leaders at the top, especially being mindful of just like, man, there's a lot of eyeballs on you that you don't know that are on you right now. And you can do a whole lot with just your actions and how you go about it. And again, what you leave on the docket that you don't get to says a lot about who you are if you're prioritizing things that do matter.
You realize in a leadership position, as soon as you leave the room, fortunately or unfortunately, a lot of the topic of conversation may or may not be about you. And hopefully, hopefully that's a positive discussion. Because if you think, in your experience and in my experience in the past, spend a lot of time talking about the people who we've worked under. And now if you have people working with you, but in, a sort of an under position, I'm sure they spend a lot of time talking about us. And you want to leave that room feeling confident that the culture and the atmosphere that you've left behind has left a positive impact. So when people mention your name, they say, I really like the way he or she does that. I really learned a lot today. I would love to be like him or her one day.
Early in my career, there was situations I found myself in that felt time sensitive, and decisions that impacted people, organizational, leading a good sized team. And so it's like the pressure to make a call and the pressure to make the right call was very, and for me, especially earlier in my career, one of the things that, I ended up coining it as borrowed courage. And as corny as that is, but that's the best way I could describe it as, because I had a mentor of mine who I would honestly try to embody and be like, okay, if I could adopt those characteristics of that person who I have such admiration for, like, what kind of posture and what kind of confidence would they make the call in? And I'm going to borrow that courage and do that thing and almost pretend as if I had those. And that helped me tremendously. But it was, again, because when that leader left the room, I was positively impacted, and that residue was kind of left with me. And so now it's like, okay, well, man, now I get to be that for the people I'm leading. And so what a position of honor when we talk about impacting people and impacting organization. And what I love about all that is that's going to show up in the results. It's going to show up in the numbers and the metrics. Not always the first thing you think about when you think about that kind of leadership and influence, but it helps everything across the board.
It's also fleeting, right? So I think your experience, I don't even want to call it the top, but your experience at the top can be fleeting. So, you don't rule forever. Heavy is the head that wears the crown. if you're in this privileged position, you should take full advantage of it and do good with it. Because obviously we know of plenty of people who have taken the leadership mantle and run away with it and done terrible things with it. So if you're in this privileged yet ephemeral position, do your best to leave a positive culture. We're not perfect. None of us are perfect. And we can always learn from people above, below us, and to the side of us. But recognizing and being grateful for that opportunity is something that I try to work on every day, and I'm sure we can all work on.